Good afternoon, everyone. Welcome. We still have a few people who will be logging on over the next few minutes, so we'll wait a minute or two before we get started with the webinar. Okay, well, I think we'll begin. So thank you again for joining us for today's webinar titled The Psychological Management of Burns Patients. My name is Dr. Miroslava Romach. I am a psychiatrist and co-director of the Ukraine Pediatric Fellowship Program, which is situated at the Hospital for Sick Children in Toronto. I will be acting as our moderator for today's session. This webinar is an initiative of the Ukraine Pediatric Fellowship Program, a program that is supported by sick kids to improve the quality of pediatric health care in selected children's hospitals in Ukraine. The series was organized in collaboration with our Ukrainian colleagues as part of our efforts to provide ongoing pediatric physician training while recognizing some of the difficult and unique circumstances within Ukraine's healthcare system today. Before we begin, I'd like to go over some housekeeping rules. Today's webinar will be recorded, and we will make the recording available on YouTube for those who are unable to attend. Also, live interpretation between English and Ukrainian is available. If you look at the bottom of your screen on the right-hand side, there is a globe-like icon. This is for interpretation, and you can choose the language that you would like to hear, either English or Ukrainian. If you wish to hear the interpreted language only, then click Mute Original Audio. You can ask questions anytime, please, by using the Q&A function on your screen. We'll try to get to as many of the questions as possible today and have our speaker respond. If we don't get to your question, they can be sent to our project manager, Laura Lewis, whose email is posted in the chat. So today's webinar is the first of three seminars on the fundamentals, principles of pediatric burn management. This includes organizing a burn management service, nursing education, and psychological management for burn patients, which is the topic that we're covering today. I'm pleased to introduce our speaker for today, Dr. Mark Hansen. Dr. Hansen is a child and adolescent psychiatrist at the Hospital for Sick Children and professor in the Department of Psychiatry, Temerity Faculty of Medicine, University of Toronto. Mark is an outpatient psychiatrist who specializes in the psychiatric assessment and treatment of preschool-aged and school-aged children with anxiety and behavioral conditions. And for many years, he acted as a consultant to the burns unit at Sick Kids Hospital. He is now the Director of Educational Scholarship and Innovation and the Fellowship Director at the Hospital for Sick Children. In the past, he was the Associate Dean Admissions and Student Financial Aid at the Faculty of Medicine, University of Toronto. And his current scholarship area of interest is focused on the future of medical school admissions in the age of artificial intelligence and patient engagement in the selection of medical trainees. Welcome, Mark, and thank you in advance for agreeing to participate.
Oh, well, thank you so much for asking me. It's an honor to do this, and I'm hoping the talk today will be helpful in your care of young children and teens, school-age children who are suffering with burn injuries. And so the presentation will focus upon approaches to child and family-centered mental health care for children with burn injuries. I have no financial conflicts or disclosures to present to you in regards to the presentation, and Laura will be advancing the slides for me as we move forward. So if we could go to the next one, Laura, that would be great. So there are a number of topics I wish to speak with you today. Family lived experience with burn injury and burn care is integral to the presentation, and I will be weaving it through the presentation as I focus upon these other areas: child and family-centered care, parental supportive care. And I did have to add in here at this point, I will also be talking about school reentry and burn camps after parental supportive care. We will speak about trauma-informed care and parental guidance with children and adolescents with burn injuries. We will speak about Ukraine burn prevention programs that are going on, and I'll finish with an overall child and family-centered mental health care approach that you can take with children with burn injuries. So if we go to the next slide, Laura, this is how I will take excerpts of the lived experience of families with children who have burn injury, and there is a literature related to this, and I have included in this presentation at the very end of it, the references that I've taken these excerpts from, and if it's helpful, I can certainly send those PDFs of those papers to you without any problem at all. But the first one is a parent who speaks about how, unlike other surgeries, because if you have a broken leg, it heals no problem, but burns is a long process. It's traumatic for the family. The guilt, when they're children, it's not their fault. Sometimes you begin to think it's your fault, our fault, and that's a big trauma for us. And that's a parent's perspective. An adolescent said we could have taken a more holistic understanding of different options, and for my parents as well, knowing there were options for them as to get support, in particular for his mother, because of the support and process for her was difficult, and for this young teen, undoubtedly his mother was instrumental for his well-being. So if we could go to the next slide, and that's why I wish to speak and focus all our approaches in a model of child and family-centered care. This is quite ubiquitous, but Sick Kids certainly presents their model of child and family-centered care. And as you can see, definitely the child is at the core, but as you move out, the family is integrally involved with the care at Sick Child's for their child. And it expands out to the community, and that's where we'll speak about school reentry, how to approach that, and also the burn camps, which have been utilized across the globe, actually. And then when we get into the healthcare system, that's more where we can speak about burn prevention program that was in Ukraine, and I will expand somewhat to landmine and unexploded ordnance prevention programs, which are active within the Ukraine. So it's taking this model that is very broad-based, begins with the child, of course, but goes out to the different layers of interaction that child will have with their parents, the treatment team, which we will speak to, and also the community health system. And integral to this is the patient experience and helping that help us and drive the care for children in across the board in terms of healthcare, but in particular, we will be focusing upon children and teens with burn injury. So Laura, if you could go to the next one. Here we'll speak about the lived experience and the injury and the wound care. The top one speaks about an adolescent who says, I remember I was really shocked and I thought, now that's never going to recover. That's what she thought at that point in time. Her legs looked ugly. They'll never be beautiful again. So when speaking about care for children and adolescents with burn injury, it's the event, the actual injury as it occurs, but also there's the aftercare that goes along for these young people. The one parent spoke about how she thought the day of surgery was the scariest part for her. So as the trajectory unfolds, you have the injury, there'll be surgery, and then this young adolescent in the final quote here speaks about even though you were given medication 2 hours beforehand, but the pain is still all encompassing. That even with the medication, it still hurts. And that was the worst because you think, oh, medication will help kill the pain. Then you don't know what hits you. That you suddenly experience so much pain is just hard to understand. And that's specifically talking about the wound, the more immediate wound care, not the reconstructive surgery pathway, which these children will, for many of them, go upon. So as you can see, it's the injury, wound care, and surgery. That's the path these children and families are on, and that's the path that we wish to provide them care for. If you go to the next slide, here is where we see the lived experience for some young people. There can be post-traumatic growth. So you have two adolescents saying here, because it sort of changed everything. Because now I'm thinking I should be a burn doctor. I want to help other people. Before I wanted to be a vet, but after the experience I've had, now I want to be a burn doctor. And certainly that there can be that shift from the traumatic experience, but there can be growth for some young people in that type of situation. Another young adolescent says, "It sounds strange, but that I sort of had a nice time there, precisely because I was so vulnerable and found it so frightening, and that the people were so helpful to me." And I just want to make a comment here that when I was, as it was mentioned, Miroslava mentioned that I was previously the burn psychiatric consultant to the burn unit, and I found my time on the burn unit, the staff there, the nursing staff, child life specialists, the surgeons, they were some of the most dedicated people that I've worked with in Sick Children's Hospital, and you will meet some of them later this week. Um, but it's that type of care for the children and young adolescents that you can see um, is necessary in this situation because it's so frightening. And the children and the teenagers will definitely appreciate that level of care and compassion that you can show them on a day-to-day basis during their time. And that was certainly something that I myself, as a clinician, experienced the dedication and compassion that staff who work with children and families with burn injury can bring, and it is with great benefit to the families. If we could go to the next slide, Laura, what I wish to speak about here is here again a focus on parental supportive care during wound and surgical care. And this is adapted from a paper, which you see highlighted below, which was focused upon the wound care period in particular. But I believe that you can adapt it more broadly to the ongoing surgical care and reconstructive surgery, which some of these children will have. But these principles, I think, can be brought across the board. And the first one is the child and family centered approach, that you need to involve the family in the wound care period, but also subsequent surgical care for them, because the parents certainly there will be a great deal of distress and worry, but they know their child optimally. And so you can, as a clinician, can gain from that experience of the parent. So I think to focus it in the child and family centered approach, which we started off with, I think is the way always to go. You need to think about the parental abilities and can they control, and here it says controlling their own emotions and being responsive. And this certainly can be during the initial wound care. It's a very stressful situation. The parents can be very stressed by this, and you wish to have an open dialogue with them about their emotions and how to best manage them. How can you be helpful with them? Because it could be a situation that if the parent's level of distress is such, it may accentuate the child's distress during wound care or in subsequent surgical care. And can the parent be responsive in these situations? And certainly for the clinician, nurses, psychologists, being responsive to the parent also. Another important element of this aspect is to be transparent and open with the parents about the situation, because it is an opportunity to provide them information about the care for their child, whether it be initially about the healing process or in some subsequent surgical care, what would be necessary with respect to the child going home, what type of care would they need, how do they get back to school, these types of things. So there's a great deal of information that can be conveyed to the parents at this point in time that can help them help you care for their child. And you wish to help the parent find a meaningful contribution, whether it is initially during wound care or subsequent during the surgical care. How do they meaningfully help the care of their child? Because in these situations, there will be significant parental guilt, and so that can assist them in managing their guilt. In that these situations, they can actually contribute in a meaningful way, and they know their child best, and they can help you very much in the ongoing care. Another area to be aware of with the parents and to be open and discuss it with them is there will be distress related to the burn event itself, we mentioned previously that young teen who was very concerned about the look of her legs afterwards. And so there will be distress in that way, but it's a situation of shared distress with the child and their parent. And so to assist the parent with their level of distress will assist their child in terms of how they're reacting to the wound care, surgical care. And this also is to look at the child's best interest in what will help the child, whether it be the wound care and surgical care. And this in particular comes up with wound care and a discussion with the parents about their presence during the actual wound care. Because in instances, certainly the parent can be help their young child during that period, but there may be instances in which the parent feels that it's not in the best interest of their child, that their emotional reaction may be such that they think they may worsen the situation with the wound care for their child, so they may step out and not be involved. But I would recommend not looking at that as a wrong decision by the parent. It's the one they need to make for themselves, and that you support them in that way, because there may very well be, you still need to give them the information, knowledge about wound healing, even though they may not be directly there during the wound care, but also support them in supporting their child afterwards. So it can be a decision that some parents will make, that they actually think it best that they not be involved in the wound care directly. If you could move to the next, uh, that would be great. And this is where I was speaking about, we get into some discussion about school and also burn camps. But here you'll see, in terms of the experience of two parents, one saying, the principal called an assembly to inform the whole school about her son, and encouraging them not to laugh, instead to be supportive. And when he comes back to school, that made the whole process of re-entry into school much easier for him. Another parent mentioned about, so he went again back to school after his injury, and on the third day, the teacher called, concerned about her son, and explained that all the parents needed to be called and there needed to be a meeting where they could be educated about burns with children, because the children were laughing at this young boy every day. The teacher was able to bring all the parents together. She did not exclude any of them. They all needed to know. So that after that meeting, her child was not bothered by children, not laughed at, and was able to get back into school. If we could go to the next slide. And certainly putting this seminar together, I was trying to see how I could find out about Ukraine as best I could, and I came upon the School of Superheroes. And you'll know much more about this than me, but it's the schools in various hospitals, because here in Toronto, in Sick Children's Hospital and other pediatric hospitals, it's quite routine for there to be teachers embedded in the hospital and providing education for children while they're in hospital for longer periods of time. So I felt that to speak a little bit about the school and the importance of that for young children with burns, and that one needs to be staying connected with the school and think about reentry planning. Um, when children are in and recovering, and when they're stable, connections could be made to the school. There perhaps could be schoolwork brought into the hospital itself. It can be, in some instances, have children keep a little bit of a diary, maybe some photos of their experience, because when they go back to school, they will be asked questions by children. It may help them if they have a little bit of a diary of what it was like, but for certainly to go over this with their parents and whatnot. But it's extremely important to get children after burn injuries back into their routines. And school is the big routine for all young children, school-age children into the teenage years, because this is where their friendships can be rekindled. There's the routine of getting up, going to school, lunch, coming home, the social and learning skills. So it's key to re-engage the children in school. But there are clearly challenges as brought up by the lived experiences of these parents. So it's something that needs to be coordinated and to reach out to school ahead of time, but to have the uh, hospital, the burn team engaged in that. And if certainly if this is something that would be of interest. This is something, there are guidelines that can be that I could share with you subsequent to this seminar on the steps in reentry for children with burn injury. But it's very important to look into this because this is one of the ways in which we can get children with burn injuries back into their routines of everyday life. And it's very important for that to be done. But it's not something done by the parent and child independent of the burn health team, and trying to work together with the health team and the school as to what would be the direction to go. As you can see, it can be quite involved, as in those excerpts that I show, where these principals and teachers actually engaged the school, the children that were directly engaged with the children with the burn injury. So it's is something that needs to be planned, and certainly there are uh, information that I could provide you subsequently on the steps by which you could go if this is an area that you wish to continue to look into. Laura, if you could go to the next one. So this is about lived experiences, friendships, and socializations. And this is one adolescent who said, some kids are mean, but you just have to you can't focus on that. You've got to focus on the people that are good to you. They're your real friends. And certainly this is something, certainly discussing with children on with burn injuries, with returning to school and friendships. But often in my work at Sick Kids, I consult in a number of situations where it may be challenging for children to go back to school, and the worry about kids bullying or being mean to them. And those children are there, you can't deny it, but you want to try to help the child focus on who their real friends are. Another parent mentioned about how her friends she always played with at home, and even if she says no, the friends must come over. And so this parent was determined to very much re-engage her child, even in the situation where she was reluctant, because the parent knew that longer term it would be invaluable for this child to regain her friendships. As the parent said, she can see in her mind, and her mind tells her that no, they want to be my friends. And that's very, very important. Laura, if you could click over to the next. So this is where I, when kind of searching my efforts at Google to find out more about Ukraine and the experience right now for children with burn injury. And this was an article from the Detroit Free Press, which is um, uh, not here in Canada, down in the US. But I highlighted this because it speaks about the burn camp experience. In my understanding, I'm sure many of you would be familiar with this. There was an American team of surgeons, anesthetists who provided reconstructive surgery and burn care for a number of Ukrainian children over in Poland. And this is a group called Doctors Helping Children. They've been engaged in Ukraine for some time regarding pediatric burn care. This group comes from primarily Boston, not exclusively, but from Boston and Harvard and the Shriners Burn Hospital. The Shriners hospitals are primarily in the US, but also in Canada, and they do various forms of specialized surgical care for children and teenagers. And one of the areas that they focus upon is burns. I certainly visited this hospital in Boston many years ago, and they've forged a connection in terms of burn care for children and adolescents, and maintain this connection with their outreach to Poland for Ukrainian children, but in Poland. So if we go to the next slide, and this is just to show a little bit about burn camps. And in Ontario, we have what we call Camp Bucko, which is burn camp for kids in Ontario. But there's an international association of burn camps. This is through the American Burn Association, and it includes both primarily US, but also some Canadian burn camps. And there is a European Burns Association, and they actually have guidelines on how to develop burn camps. And that too is something that we can certainly make available, but they can be valuable in building the confidence, self-esteem of young children, teenagers with burn injury, enhancing social skills, friendships, companionship, and a sense of belonging. So they can be quite a lot of fun for young children and teenagers with burn injury, but they also can help them in terms of their confidence and self-esteem. There can be burn camps that are primarily focused upon having fun, but there are burn camps that children still are having fun, but there can be more of a therapeutic component to them. But that would be something that could be considered and thought about longer term. And as I said, there would be the European Burn Association, which has a document for how to develop burn camps, but also the International Association of Burn Camps has regular meetings. So this is something where if this is an initiative to proceed with, there would be connections that we could forge with these organizations. If you go to the next slide, Laura, that would be great. So I want to talk a little bit about the lived experiences and trauma. And there's multiple quotes here. An adolescent saying, she was having bad flashbacks, but it's gotten less now, but still on TV, if there's a fire, this young adolescent can still get a flashback to the fire and the incident of this young adolescent's burn injury. And here again, I just have the memory, and then I get a bit more scared that it's going to happen again. Another one, adolescents said, if someone does something like lighting a leaf that's dry, you just never know. Maybe there's some petrol there, and then boom. Then it's instantly one giant flame again, and you never really know. Again, the kind of memory of the trauma of a burn related to a flame burn. The final one is a parent. I'm probably also a bit more hypervigilant now, very reluctant. I struggle to leave my child in the care of others. I'm still trying to let him take, the developmentally appropriate risks, but that's definitely a lot harder for me to do now, given the trauma of the injury. So here again, it being from more of a family-centered approach and being aware that the parents are actively involved in their child's traumatic history. If you could go to the next one, next slide, Laura. This talks about the lived experience and help seeking. And so I think we need to see that our patients with burn injury very much wish to seek help with their trauma. One adolescent, I think that before I started seeing the psychologist, I actually didn't deal with the stress or anxiety very well because I didn't really have the skills to do it. But I think now breathing exercises and stuff like that work. Another adolescent mentioned, and then having the understanding how to reach out for help, how to get the help, because there is stigma. There's stigma regarding trying to get us help for mental health issues. And I think that definitely it should not have taken me this long to get a psychologist, just because it's just the normal thing ever. It should be the normal thing to seek out help from the psychologist in this situation. And then the final excerpt from a young teen is, I would like to be able to tell my story in a more positive way, because most of the time your brain always thinks about the negatives, not the positives. So indeed, these young adolescents were looking for assistance and help in regards to the aftermath of the burn injury, the psychological aftermath. If you could go to the next slide, Laura, that would be great. In this, I wish to speak a little bit about the psychotherapies in burn injury. On the left side, on my left side here, what I'd like you, these are let's say, the more common psychiatric conditions with children, adolescents with burn injury: anxiety, PTSD, acute stress disorder, depression. But I'd also like you to think in terms dimensionally, in terms of the symptoms, and not just our diagnoses often are categorical. You either have it or you don't. So you have anxiety or you don't have an anxiety disorder. In my experience, and the literature would suggest a number of children and adolescents will have anxiety symptoms, they'll have symptoms of PTSD, but they may not meet categorically the diagnosis of an anxiety condition, the diagnosis of PTSD. I would still recommend that you provide psychological care for those young people, even if they don't technically meet the diagnostic criteria. And looking at the therapeutic techniques in psychotherapy for PTSD, the literature shows there's a range of techniques used in the kind of psychological psychiatric care of children and teens with burn injury. It's not as advanced as the surgical care. The surgical care has really moved forward in a great extent, but the mental health care has not systematically been addressed in children, teens with burn care. So when looking at these therapeutic techniques in psychotherapy, they have not, we haven't a lot of literature, a lot of work done on these techniques specifically with children and teens with burn injury. There is actually a major study going on in Australia to do just that with children and teens with burn injury. But in looking at the techniques, most commonly they're a cognitive behavior therapy strategy or technique. And these would be the common areas that are irrespective of the therapy that is utilized, and that being psychoeducation regarding the condition, the symptoms, coping skills, as those were certainly mentioned in those excerpts from the teenagers, and creating a trauma narrative, enabling the young person to describe and talk and look at how they've their narrative, and then cognitive restructuring to try to, for instance, that adolescent who said that they automatically, if they see something, they automatically think it will happen again, or the burn, the flame will just explode. So some cognitive restructuring with respect to their memories of and their trauma narrative, and then to create a post-treatment plan, because these can be ongoing symptoms the individual may have. So although the treatment may be finite, indeed there needs to be a post-treatment plan. This I commonly do with, as it was mentioned, I see a lot of children with anxiety conditions, and we provide them treatment, cognitive behavior therapy predominantly, but then there's also, when that's done and we have a post-treatment plan, in the event that symptomatology reappears or intensifies, for the child, how to reconnect with myself and their therapists. So that would be what also needs to be done here in a post-treatment plan for these children and families. If you could go to the next slide here. This is parental guidance, burn injuries with very young children. The reason I focus here is when I was the burn consultant, I was primarily young children. The burn unit at that time was predominantly young children with scald injury. So in this situation, I brought again back the text of the parent who said they have trouble with letting their child move forward in developmental risks. And this is something that you need to really work with parents on, because it may be with the younger children, the 3, 4, 5, the parent at that point in their development, they're very much focused within the family, but there are points in which a child needs to be outside from the direct parental supervision, as that parent mentioned in her excerpt, with another family friend, and there can be reluctance to do that. So the work with parents of very young children is helping them, again, the child to move forward into their normal life, which also requires developmental steps forward, being on play dates with other families, being under the care of another family member or a family friend. These are all parts of the developmental steps for young children to move out of their family circle. It can be understandably very challenging for parents who have young children who have a burn injury. And I put on here the young boy here with the fire and fire play. It's a misnomer. It's fire play, because in very young children, uh, playing with fire or matches is a significant cause of flame burn injuries for them. You see the young child who, with the pot there, resulting in a scald injury. And then we will speak a little bit about this in terms of landmines. And I bring this up in terms of when I was taking a look at this in preparation. Unfortunately, again, a number of the injuries around landmines or unexploded ordnance for very young children relates to their play around these types of very dangerous types of items. So these are with very young children, their lack of awareness of the danger, it puts more onus on parents and their supervision of their young children, in particular, prior to an event, but even after, trying to lessen some of that supervision appropriately, such that the child can move forward developmentally. If you could move to the next slide. So I'm going to move a little bit more to health system, and that would be public health burn injury prevention within Ukraine. And so if we could go to the next slide, that would be great. Laura, that's great. So on the left, is there, as I mentioned earlier, there was the team from Harvard, Boston, and the Shriners who actually developed a burn database in Ukraine and actually made a burn prevention program for scald injury for very young children. And that's their emblem, the purple emblem on the left there. And it was successful. It was moving forward. But in their last publication regarding this burn prevention, it unfortunately had to be stopped, obviously, during the outbreak of the war. But certainly the infrastructure at that point for burn prevention for young children with scald injury was present. Their study showed that burns related to scalds in very young children was occurring at a higher rate than scalds in the American Burn Association data set. So that's why they chose scald injury for very young children, and that was the focus, and there was some evidence of success of that. To the right, UNICEF has put out a landmine safety program for teachers and I think first responders to help young children, teach them about the dangers. This program focuses on 6 to 16-year-olds. So the group of under 6, the very young, will not be able to, do not have a program focused on them. But this program is available. It began not too long ago at the end of 2023 in December, and you're undoubtedly aware of it, but I felt it was important to bring it up here because this would be the explosions in part are a source of burn injury for young children. If you could go to the next slide. And so at this point, I just wanted to finish up at this moment with this is an overall approach to child and family-centered mental health care for children with burn injuries. And as you can see, it has different phases of it around the trauma itself and that initial point. And from the psychological point of view, looking at the types of intrusive thoughts the child has and beginning to try to target them from a psychological point of view. Then there is the hospitalization phase, and this is where we discussed how the actual wound care itself, and I would also say subsequent surgical care, are points of traumatic experiences for children and school-age children with burn injuries. So that is something to be aware of, and it outlines various strategies to assist parents and children. And then post-hospitalization, there still is a coping that the parents and children can benefit from. And certainly there is a focus upon parental support, but also peer support. And we've spoken about the importance of getting children back to school, the importance of burn camps to try to help young children and school age and teens in terms of support for them. And Laura, if you could go to the last, that would be the the focus part of the presentation. So I'd open it up to any questions that individuals might have at this moment.
Yes, thank you, Mark, for an excellent
Okay.
overview of this topic. I could see that we have some very detailed questions,
Okay.
important questions for you.
Okay.
So we'll proceed to those. Dr. Zoriana Ivanyuk will help. They are in Ukrainian. So Zoriana, do you want to go to the first question?
Добре. Дякуємо дуже вам за надзвичайно цікаву лекцію.
Thank you very much for an extremely interesting lecture. Question number 1, where we could find the guidelines that you mentioned you wanted to share?
That would be for the burn camps and the school reentry. Is that correct? Because I can make those available to Miroslava. I can get you because the European Burn Association actually has a guideline for burn camps, and I can certainly get that to Laura and Miroslava. And then there is a guidelines around school reentry, and that is American based. But that I can certainly get that to you very easily.
I suspect that the question is about specific instructions in terms of whether it's school integration, as you said, but more structured information about how to manage these children. And again, if the person who's asked this question, Liana Shimonyak, if she wants to elaborate on which specific instructions, she can send those to Laura in her email, and we can respond in greater detail.
Is that, as I answered that, the document for the burn camps is about 20 pages long. And so that's what I mean. I can get that to you.
Okay, no, that would be great. I'm sure all information will be useful as a resource.
Дякую дуже. Ви рекомендуєте...
Thank you very much. So you recommend to have one psychologist and the same psychologist to work with parents and with the child, or shall there be two different psychologists? What do you think?
That's an excellent question. I'm going to answer it a little bit differently. With a very young child, that's three, 4, I would say the psychologist, I would focus my assessment and care with the parent. It's not to ignore the 3, 4-year-old, but I think most of the assistance helping with the distress would be parent mediated. And then at that young age of child, I think it could be certainly one psychologist. As the children get into those teenage years, my hunch is Ukrainian teenagers are probably like Canadian teenagers, and they like to have some distance from mom and dad. That may be a generalization, but as you get a little bit older, if it is the same psychologist with the parent and the teen, and it may, I don't know what your resourcing availability is. You'll need to be very clear on the confidentiality issues between the teen and parent. Not that they're not present with young children, but it's very different. 3 and 4 and 5-year-olds are going to probably expect mommy and daddy know everything that's being discussed. But with the teenager, he or she, there may be elements that he or she wish to be discussed independent of mom and dad. So it would be, that's the key element to me. Certainly I am in situations where I am seeing both the parents and teen, but I'm very clear on the communication, confidence, and who my patient is. I'm a child and adolescent psychiatrist, so my patient is the teenager. So my confidentiality goes with that teen, but I do have communication also with the parent. But there may be situations where it may be optimum for there to be 2 psychologists. So I hope that answers it. I would look to your judgment in the clinical situation. One, probably more commonly one with very young children, but you just saw our Maverick, our family dog, just kind of walk through the screen there. But for teenagers, it could be 1, could be 2, depending on issues of confidentiality. And also resourcing. I'm not fully aware of the resourcing. And so it's not that it would be, would not consider that it would be inadequate, like inadequate care if it was one psychologist with the teen and the parent, but it's just one needs to be very open and clear as to confidentiality and being aware of that with teenagers.
Thank you, Mark.
Дякуємо дуже за відповідь.
Thank you very much for your answer. The next question.
Дякуємо за
Thank you for your
лекцію. Є
interesting
запитання
lecture.
від одного
There are
слухача.
several
Часто наші
questions.
маленькі
Very
клієнти
often,
передають
our
нас
little
повернення
patients
в лікарню.
have already had some painful experience
Mhm.
staying in other hospitals or clinics. And during the first contact in our clinic, the first thing they do, they cry and they are afraid. How could we reduce this fear for doctors due to their prior experience?
Oh, that they have fear. The fear was the medical care they had from the physician in the previous hospitalization carries over into the next hospitalization.
Exactly.
Так, тому що ми
Okay.
є третинним центром, я
Exactly.
так поясню вам.
Because I will
Yeah.
explain to you, because we are like the tertiary burn unit. So we only have the most severe cases.
Right.
The children come from the primary care institutions.
Okay. Well, in an overarching approach, I think that there's value in trying to educate the primary care as to what would be better or more appropriate care for the children would be one point. That's more of a longer term. This would be the situation where I would be, and I'm assuming since you're saying our little patients, we're talking about the 3, the 4, the 5-year-old. This would be a situation where I would very much work with the parent. I don't see a way to automatically quiet the crying, but to kind of work with the parent. How can you reestablish trust with the child and the parent, that to have a transparent discussion about what happened before, the impact for the child, and how you would do the best you could to not repeat that. Now, it may very well be with some of the wound care, because the wound care can be very distressing and painful. You may still need to do that at your institution, but it would be very transparent, open about what happened before, how you would try not to do that as best you can, but trying to build trust over time.
Дякую дуже.
Thank you very
зараз
much.
говоримо про опіки.
We are now talking about the burns,
Ми зустрічаємося
but
не лише з побутовими
these
опіками,
days
побутовими
we
опіками,
face the cases not only of household trauma, but the combined, like a blast trauma, explosion trauma. How do we explain to the child that when the child is not the only traumatized person, but also the family members have been traumatized? How do we work with such children?
Well, this is where I would say that this is where we're talking about the kind of child and family centered approach. It may very well be to speak with the family together as to the event. Sometimes what happens is, let's say a sibling who wasn't injured, may not have that traumatic explosive experience or burn experience, but now their parent, their brother, their sister are in the hospital, and there's the kind of the trauma of the separation. So I would very much try to focus upon it being more of a family-centered approach, because there's multiple people and multiple family members involved, to try to help the family kind of using the principles that I put down in terms of treatment in this arena, to try to help the family with coping mechanisms, kind of developing a trauma narrative with them. What are the strategies to kind of some reconstruction of that, their memory of the event, and try to help them move forward in that regard, to kind of take the principles we spoke about in terms of treatment in general, but to apply them more broadly within the family, but within a child and family-centered approach.
Thank you, Mark. There is another question. Do you have any
Так,
experience?
маємо ще одне питання. Чи ви
Yes,
маєте
we have
досвід
another question. Do you have the experience of using art therapy, therapeutic art, for children and adolescents with burn?
I myself have not, but I know that it's utilized. The primary treatment approach that I'm more familiar with would be the cognitive-based therapies that I spoke of. But certainly I know there's efforts, music therapy, art therapy with children with burn injuries, but not just burn injuries, with trauma related to medical procedures. But certainly I'm aware that these therapies are utilized, but I don't have direct experience with them.
Дякую. І ще одне
Thank you
питання.
very much. And another question.
Зазвичай діти, які мають
Usually,
велику кількість
children,
військових
especially those who have a lot of post-burn scars, find it difficult to accept themselves, to embrace this. How do you help them?
Well, this would be, well, first off, one of the areas that I'm suggesting, and this would be initially, because I don't know the experience of the specific case or cases, but this is an element of the burn camp, which, because it brings children together who have significant or less significant burn injuries, to try to help them with their self-confidence, skill development. The school reentry is to also try to help them, young children, with decreasing, because an element certainly of the school reentry is to decrease the teasing and the bullying that can go on. So those are more social types of events. One avenue that have utilized here in Canada, I did try to see if there was something in Europe or Ukraine, it was developed in the United Kingdom. It's called About Face. And it's a support organization for children and adults with facial differences, to try to bring them together. There's activities for children to try to help them develop their self-esteem. My limited Google searching skills, I couldn't find if there was an About Face in Ukraine. I know it began in the United Kingdom. It's here in Toronto. And so for some young children, not just with burn injury, but I've had cases where due to other traumatic experience, there may be some disfiguring, so facial difference. And this is a program that is available to try to help those young children. But I wasn't able to find a connection for that in Ukraine. But it might be the type of thing with connections to try to look into that. Because as I said, to the best of my knowledge, it developed in the United Kingdom.
Thank you, Mark. There was a clarification on those instructions.
Yep.
That were requested earlier on, and that was with respect to school reintegration. What are the steps that can be taken?
Oh, I have that was the one, and I can get that to Laura and Miroslava. It's from the US.
Okay.
And it's not 20 pages, so it's not as long, but it does speak to school reentry, connection with the schools, the burn and health team being engaged in that. So it's trying to be open in communication, because the schools don't know what these children might need, some accommodations in terms of their learning too. So it's very helpful in that regard, and I will get that to you. Absolutely.
Okay. And we'll try to squeeze in the last question, Zoriana, there from Helena.
В нас були випадки, що дітям
We had cases when children find it quite easy to accept themselves, but it's more difficult for parents to accept that their child's body is never going to be the same. Have you ever worked with such parents?
That's not unique to I think the children with burn injury, but parents who have a different path for their child. And it would be meeting with them as to trying to understand better why they have that certain path they wish to move forward. Certainly, I've been in situations with burn injuries where it's interesting how you say the child acclimatized, and that's why I wanted to show the post-traumatic growth experience statements, because some young children, teens, are able to grow from this, but that's their individual growth. The parents may not be able to see that, and so that's why it would be meeting with the parents independently in that situation, because it may, as you say, I could see they may have thought their young son or daughter, they had a certain plan for their life, and it's changed now. But it would be trying to understand from the parental perspective why that's so, and to try to help them appreciate that their young son, their young daughter may not be able to go on that path, but there's other paths to go, and perhaps their child is seeing that at that point in time.
Thank you. Thank you all. If you have any additional questions, you can send those to Laura, and we will try to get back to you with responses. As a reminder, again, we'll be posting all of the webinar recordings also onto a YouTube channel. So to view or subscribe to the channel, you can click on the link that Laura has posted into the chat. And so thank you, Mark, again. Our final 2 sessions of this series will be held on March 28th. The first session at 1400 hours Kyiv time will be led by Dr. Joel Fish, and it will be entitled Organizing Burn Management Services. The second and last session will be led by nurse practitioner Charisse Kelly, and that will be at 1600 hours Kyiv time on the principles of nursing education in burn management. If you haven't already registered, please, you can click on the link provided in chat, or you can click on the QR code in this slide. Laura has reposted the link again. Thank you for joining us today. Thank you, Mark. Thank you, Dr. Zorian Ivanyuk, and thank you, Laura, for all of your support today. We will continue working together to try and improve pediatric healthcare and making a positive impact on the lives of young patients in Ukraine. And we hope to see you at the next session. Дякую.
Thank you.